And good evening. Welcome back to Bite-Sized Learning with the Ohio Academy of Family Physicians. I am Mike Sevilla from Salem, Ohio, and that's right, we're back. If you're new to Bite-Sized Learning, welcome. We have conversations with family physicians, residents, and medical students about things that are important to family medicine and to our communities. We have a great guest and really important topic that we're going to be covering in just a few minutes. But I just have a couple of announcements just off the top here. Over this past week was Match Day, and I know that we have medical students and residents who watch this program. So congratulations to everybody who matched in family medicine, and we welcome you to the family medicine family. So second announcement is for those of you who are chief residents, registration has opened for the OAFP Chief Resident Workshop, which will be on April 23rd, 2022 at the Ohio Association of Community Health Centers. And this is a very popular program for the OAFP and help give some leadership tips and tricks, especially to those new chief residents out there. You can get more information at ohioafp.org. So now I want to just kind of introduce our topic and to introduce our guest. Our topic is something that has been out of the headlines, but something still very important to Ohio and to the country, and it is the opioid crisis. And I remember just a few years ago, right here in Columbiana County, there were some national stories here of really tragic stories, and may have heard other stories from Ohio and Columbus and Dayton and other places. It's still a really, really important topic, and for those of you who are sensitive to this information or triggered by this type of information, just be very careful with some of the topics we're going to be talking about. It's still very important, but I just want you to be aware of our topic this evening. So before we bring in our guest, I just want to introduce her. Beth Weinstock, MD, is a family physician at Equitas Health in Columbus. A mother of four whose eldest son Eli died in March of 2021 when he unintentionally ingested fentanyl. This conversation is a follow-up to her article in the Ohio Family Physician Spring Edition 2022 with the same title, The Fentanyl Generation. Dr. Weinstock will share a story of grief and how it led her to a new mission in life. In September 2021, Dr. Weinstock and her daughter launched the nonprofit BirdieLight at birdielightorg to educate parents and young people on ways to reduce the harms posed by fentanyl use. So now we're going to welcome our guest, Dr. Weinstock. Thank you so much for being here.
Thank you, Dr. Sevilla, for inviting me. It's an honor.
I'm very sorry for your loss, and I'm happy that you're going to be sharing your story. But before that, just to kind of introduce yourself to our audience, let us know, where did you grow up, and how did you, first find your way to family medicine in the first place?
Sure. So I grew up in Cincinnati. I went north, I hate to say it, to Michigan for undergrad, and then I came back home to Columbus for medical school. And I went to Riverside for my family medicine residency here in Columbus. What brought me to family medicine was it always seemed to be so noble, this idea that you would um, care for a patient and then care for them for decades and then care for their family as well. And the concept of it fascinated me. And I think it's held true for me, the fact that I've been doing this now for 25 years. And so I've got decades, and I have some patients who have been with me the whole time. So I I never really looked back. I always thought it was such a noble profession, if I can be self-congratulatory for us.
Exactly.
Yeah.
And I was reading in your bio, you have a passion for poetry, or you teach poetry workshops. What is that about?
Yeah, I've always had a passion for literature. I was an English literature major as an undergrad, but then about 5 years ago, went back to school to get my master's in fine arts and poetry, and, realized that family medicine is a complex and demanding profession, and I was getting to the point of, my maximum capacity. I realized I needed to develop another side of my brain, so I do both now, among other things, which I'm sure we'll discuss.
Sure, sure. My guest is Dr. Beth Weinstock from birdielightorg. There really is no kind of adequate transition to this, but why don't we start talking about Eli, and you can start wherever you'd like, and to share our audience, his story.
Sure. I have 4 kids, the second oldest of which, Eli, died in March of 2021, at his college apartment in, Washington, DC. He was a sophomore at American University, and, he collapsed and died due to an accidental fentanyl ingestion. Um, the other substance that he had in his body at the time was kratom, which is an herbal supplement. And so, Eli did not intend to die. Eli was not struggling with a substance use disorder. He was a young adult who experimented or tried to use something recreationally and did not know that it contained fentanyl. And this is happening in the thousands across this country. Young adults who recreationally use substances and really have no idea that they contain fentanyl. um, so Eli, you know, was a great kid. He was making great decisions 99% of the time. He was a skateboarder. He was a movie aficionado. He was kind. He was funny. I could go on for hours, but he was a kid who had a bright future. He had an internship lined up for the summer. We had just seen him 10 days before he died. And it's, horrific, but we're trying to use Eli's story to educate other young adults. That's why I'm here today.
And reading in your essay, it took 3 months for the coroner to determine the cause of death. It had to be very frustrating.
It is frustrating, and I think a lot of times with accidental fentanyl ingestions, it takes a long time, and it's never really clear to me why it takes so long. In some instances, not necessarily in Ohio, I've heard it takes up to 6 months. So I mean, we were fairly clear that Eli was a healthy individual, so we didn't expect that he died from any other illness necessarily, but, it did take a long time.
And so I'm reading further in your essay, and you just have some staggering statistics in here. Um, there's a sentence that says the scale of this tragedy is incomprehensible. 2020 is the deadliest year on American record for fentanyl deaths, nearly 60,000 people. If all trends continue this year, the fatalities will increase by another 20%. That's just, I'm sure that you have a lot of other statistics, but I mean, this just that one just really jumps out of the page for me.
Yeah, and sadly, it's worse now. That was written a while ago, and they've released, more statistics for a 12-month period that spanned 2020 into 2021, and the last numbers we have are about 104,000 people died last year due to drug ingestion, and about nearly 80,000 of those were due to fentanyl. So it's worse than when I wrote that op-ed,
Yes.
and it keeps going up. And the fastest rising age demographic is age 15 to 24.
Wow. Wow. So I guess as part of this process, I mean, how did you and the family start to, educate yourself, about all these issues, and to try to put your arm around just how tragic, this epidemic is.
Well, about 6 months after Eli died, my daughter, Olivia, and I, she's 22, decided that it would help us to do something productive. And we tried to find an area, a niche where people weren't already working. We didn't want to duplicate efforts. And what we found is that there's really not well, there's no one doing exactly what we're doing, but there's very few people in the space of trying to get in front of young adults age 15 to 25 and educating them about accidental fentanyl ingestion and teaching them how to test for it. So what we couldn't find was anybody who was going to high schools, college campuses, and talking only about fentanyl. Because if we think about the scale of this crisis, this is beyond what we can understand. I always use the comparison for our generation. At the peak of the AIDS epidemic, in 1 year, 45,000 people died in 1995. That's how we define our generation. And this generation is looking at numbers that nearly double that. So
Wow.
we are trying to get in front of a very specific demographic. And because we're doing that, that also includes parents and educators. And it's staggering how many people don't know. A lot of people still think of fentanyl as it relates to heroin. A lot of people don't know about counterfeit pills, fake Xanax, fake oxycodone, fake Adderall, all of which now contain fentanyl. So, and that's one reason why I think I could do some good here today, because I think a lot of family doctors don't know that if their patient or their kid buys an Adderall in a dorm to stay up all night to study, that very likely is a fake Adderall and it's adulterated with fentanyl.
Yeah, and you see all these stories now, especially on social media and in the mainstream media, of a lot of these adolescents finding access to pills, whatever they are, on social media, and the education is not there that these type of pills are either fake and or laced with other type of substances like fentanyl. Is that what you're finding as you're exploring this topic further?
Absolutely, and we take, informal surveys whenever we speak to a young group, and they always indicate on the survey that we're telling them things they do not know, or else, for example, they might have heard about fake, oxycodone and try to steer clear of that, but very few of them know that cocaine contains fentanyl now, and there's a substantial number of college kids who are using cocaine right now. I'm not saying on a daily basis, but it's used very commonly as a recreational drug on college campuses. And so, 2 out of 3 people that we survey say they didn't even know that cocaine can contain fentanyl. So the numbers, the knowledge gap is massive, and that's our primary goal. Because what we find, even before we even talk about fentanyl test strips, is that a lot of times if we tell young people, "This substance that you've seen at parties or you've heard your friend take can kill you," a lot of times their eyes get big and they decide, "Well, no thanks then?" So it's really just about spreading information. But then we also speak of the test strips to sort of back that up if someone decides to move forward with an ingestion.
Yeah, my guess is Dr. Beth Weinstock from birdielightorg. So you mentioned a little bit about the test strips. I just started learning about that by going to birdielight.org. Can you describe to our audience what the fentanyl test strips are and what their goal is?
Yeah, the test strips are a very simple, reagent strip similar to a COVID test or a home pregnancy test. The tip of the strip is dipped into a water that contains the substance that you're about to ingest, whether it be a pill or a powder. The strips are anywhere from 92 to 96% sensitive at picking up fentanyl, and, it lights up within a minute. Now, what we teach always to young adults is that, 92 to 96% sensitive is not 100%. We are not eliminating risk with these strips. So we teach them, if you test and it's negative, you still have to tell another person that you're about to use something, a person who's sober. We're trying to make this movement like the drunk driving designated driver movement of the 1980s. And so you tell a friend, and then you always have that friend know where the Narcan is. Because if the strep, misses something, you still have to have those 2 other things in place. But the thing it helps with is if your test is positive, you throw your drugs away. It's easy. And that's where we think we have an ability to save lives.
And then, as far as access to these fentanyl strips, how do you communicate to your audiences or to this audience as far as, are they readily available now? Are they tough to get, or how would they have interest with that?
Yeah, our preference always is to have the strips with us, do the education, talk about how to use them, talk about fentanyl, and then to pass them out. And when we pass them out, they have instructions stapled to them. They have our website to get more information. So that's always our preference. However, in a lot of areas, public health departments, they pass them out freely. Some harm reduction groups, such as Harm Reduction Ohio, is starting to distribute them. um, Here in Columbus, there's several locations you can get them, for example, like at waterbeds and stuff, Columbus Public Health, and that's the same in a lot of urban areas around the state. Now, if you live in a more rural area, I think they are more difficult to get, and my organization can distribute them, by mail as needed.
And let's talk a little bit more about outreach as far as what the organization does. So you do outreach with, elementary schools or colleges, or how do those educational sessions set up? How do you set up the education there?
So our target demographic is age 15 to 25. So we try to get in front of high school students and college age and postgraduate kind of, younger professionals. Um, so far, that's what we're doing. Now, I do think this education needs to be in middle schools. But essentially, what we do is we arrange events. We go to auditoriums, we go to fraternities, we speak to parent teacher associations, we speak to nursing groups, physician groups such as here. And we just try to go, at least for now, piecemeal, event to event to event, and try to just spread the word and to create a cultural shift so that these conversations are very commonplace. Now, as we get bigger, I'm learning we need to duplicate ourselves. So, one of our big goals for 2022 and 2023 is to create what we're calling a birdie box, where we distribute instructional videos, test strips, promotional materials to college campuses and high schools around the country so that they can just implement the education themselves. And there's a certain urgency to this crisis, right? I mean, this is skyrocketing and they just keep predicting it's going to get worse. So we do feel an urgency to get to as many young adults as we can.
So the goal of this year is the creation of this kind of toolkit, a train the trainer type of thing that
Yeah.
can be distributed to schools and colleges, potentially around the country.
Absolutely. And we also have a goal to create what we call ambassadors on college campuses, like a BirdieLight club, where that ambassadorship run by students would then be able to educate their peers. Similar, like I bring up the drunk driving issue several times because it's a similar model. Like Mothers Against Drunk Driving created Students Against Drunk Driving so that the students could take agency and control their own safety.
So focusing back to kind of this audience, as far as family physicians and residents and medical students, why is it important to touch these audiences, and why are family physicians really important in this educational and diagnostic process?
Well, I think about what we do when we interact with adolescents in the office, and we do a lot of, preventive counseling around, say, seatbelts, alcohol use. Um, we make a lot of effort in our annual physicals to talk about, like cardiomyopathies and athletic risk. But if you look at the sheer numbers, there are more young people dying from this issue than nearly any other. And right now, the data shows that probably the leading cause of death right now, age 18 to 45, is related to fentanyl and opioid ingestion. So when we look to the future, when we're counseling a 15-year-old on what's one of your major risks as you move into your late teens, 20s, it's fentanyl right now. Now, I hope that changes in a few years, but I think family physicians and all primary care need to make a quick adjustment because when we talk about statistical risk, this is the big one right now. And so all of us should be counseling every teen we interact with about counterfeit pills, about cocaine, and how everything, not everything, but right now, like, 20 to 30% of all substances in the illicit drug market right now are containing fentanyl. So it's like a Russian roulette. So that's what I think all family doctors should be talking about with both parents and the adolescents they're seeing in the office.
Yeah, I mean, I wasn't even aware of the statistics. I mean, I knew kind of some of the how tragic it can be, but some of these statistics and things they're just awful. So for me, like talking to my adolescent patients tomorrow, kind of making it part of my screening process in
Mhm.
addition to asking about substances and things is to bring up this topic as well, not only about fentanyl, but things about like fake pills and pills laced with other things or other types of questions or other types of advice you have for family physicians like me to help ask those questions or guide that process when we talk to our adolescent patients.
Well, one thing I've employed when I speak to groups and small groups even now is that you don't want to lose kids because a lot of kids thankfully know, like, I'll never try a pill or I'll never do cocaine. I mean, that's going to be the first thing a lot of them think. Um, I try to encourage them to take this knowledge and spread it, right? And to say, listen, you may never use a pill or a powder. You may never do any drugs, but what you need to be aware of as you get older and go to college or start a job is that people around you might be. And you need to say, hey, have you checked that for fentanyl? Or did you know that can contain fentanyl? And so I feel like there are many ambassadors, right? And so one thing that engages them in that one-to-one interaction is just to say, listen, you could be the hero. Tell your friends about this.
Right, right. Yeah, because I know I can just kind of think in the next few months as especially a lot of my high school students are going to be going to college and they're going to be needing, whatever paperwork they need or whatever immunizations they need, and to really make this a piece of that. Um, because as you say, Dr. Weinstock, I mean, just the education piece is so important, and I do want to direct people to, birdielightorg is because just looking through that website, this important information about fentanyl and educating yourself, I think is really important. It's really good information there. So I want to congratulate your team on just putting that together. Hopefully, that's kind of a little start of this Birdie Box concept that's going to be coming forth. Just really good information.
Yeah, thank you. And we travel, so we like to get. It's always the best conversation when you're in front. It's almost like being in the office with a patient, right? When you're in front of a young person and just saying, "Hey, I want to tell you what happened to our family, and I want you to stay safe, and I want you to keep your friends safe." And you just see this light bulb go off. They just get it, and so we travel and get in front of people because that's sort of where the magic happens. And we've got this spring. I think we have 15 events, and we're already booking up for the fall. Summer's a little quieter because no students are in session, but we're still going to be hard at work, just trying to do, CME and, even camps, youth groups, things like that. So we're just trying to build a momentum.
What kind of response have you seen from the public? And I did see on the website there was also an interview on CNN, a national, news. Seems like the message and the story is resonating.
Yeah, there's a hunger for this knowledge, and I think a lot of young people are scared. It's rare that I don't find someone that hasn't been touched by this epidemic. So they're hungry for the knowledge, and the truth is that a lot of young people ask really honest questions. Birdie Light never comes in judgment. We never come to young people and say you should never use drugs. I might personally believe that, but what's happening on the ground has to be acknowledged. So we don't come with any judgment. We just say to them, we're here to move you closer to safe. We want you to be as safe as you can. And if you're never going to use drugs, then keep your friend as safe as you can.
My guest has been Dr. Beth Weinstock from birdielightorg. I mean, before we kind of close up our conversation this evening, Doctor, is there anything I forgot or any kind of closing thoughts for our audience this evening?
I would like to say, I'm sure a lot of people don't know these numbers, but we hear the over 100,000, over and over, and it starts to sound abstract. Um, at least, it seems too big to comprehend. But in Ohio, last year, the most recent statistics is about 5,600 people have died.
Wow.
Um, so that brings it a little closer to home. Franklin County has the highest numbers, followed by all the other cities. Um, but this is as we know with the opioid epidemic, this is a home problem. And I think family physicians in Ohio could do a lot to curb it.
Great, great. I guess my last question is there a special significance to the name Birdie Light?
Yeah, it's my favorite story to tell. So when Eli was in middle school, he and his buddies had a little group they called the Birdies, which we never found out why, but that was their thing. And so at his memorial service, a lot of the same guys were in our backyard for the memorial, and we had tables with little cards set up, and so a lot of them wrote on the cards, "We miss you, Birdie," and that kind of thing. So when Olivia and I were brainstorming what to call the organization, we thought we'd pull that in just because it reminds us of Eli. And we thought about the canary in the coal mine, which equates to the fentanyl test strip, right? So as we played around with the words, we wrote down Birdie Light. And then after we wrote it down, we said, wait a minute, Eli's right in the middle. Eli, ELI, right in the middle of Birdie Light. And he's in the middle of everything we do. He's why we're doing it.
Wow, that's a great story. It's a great story to end on. Dr. Beth Weinstock, thank you so much for being with us tonight, and thank you for sharing your story. I want to direct everybody to birdielightorg for more information. You know, I agree with you. Family physicians have to be a part of the solution to this. And I have learned tremendously a lot this evening, and I direct everybody to the website to even learn more. So thank you for being here.
Thank you.
And that ends our program tonight. And you can watch all of our archives at ohioafp.org. And we will see you next time for Bite Size Learning. So good night, everybody.